to the cloud. Okay, well, hi everyone. We're going to be getting people as they're coming in, and it's Happy Wednesday, our last Wednesday of March. Can you believe it? And we've got this beautiful weather that's been becoming like schizophrenic, rain and sun and rain and sun. Hey, that's the Northwest. And we've got beautiful Lauren here with her gorgeous Aurora Borealis behind us. One day I will see the Aurora Borealis. My husband's from Alaska, and I know it's going to happen someday. And we've got our wonderful panel here. We've got Gabby, who's our advanced laser esthetician. She's going to be chiming in on IPL and what she's doing with our patients. We've got Miss Amy over here, who is our temperature wonderful technician, who will be kind of chiming in on how we utilize radio frequency and IPL together a lot with our dry eye patients. And of course, we have the notorious Stevie here, who's going to be handing out the wonderful prizes at the end, because you got to stay to the very bitter end so that you can get those wonderful prizes. I think, Stevie, can you give a little idea of what those prizes are going to be tonight?
Yes, I can. Anybody, number one, anybody who calls tomorrow or Friday I'll give till noon, because I'll be here till 2. You will get 20% off of any IPL package, and one lucky winner will get to win a full face IPL treatment, and that is worth over $800.
Woohoo! Oh, that is worthwhile staying to the bitter end. And we know everybody's busy, and I'm hoping you're all getting something fun to sip your glass of wine or your water. All of us, I'm drinking some tea so I can stay awake. And we started early this morning, but it's always so much fun when we do these events. We have such a great time, and questions that come up are just fantastic. So we want everyone to feel free to chime in. As you know, you are totally anonymous, so we don't know who's here. And we want to just make sure that at the end, we'll be able to get our registry of who's actually chimed in. So then Stevie can pull your name out of our very fancy mystery little cup and we'll be able to find out who are the ones that are getting the great prizes tonight. I'm going to drop this on over to Lauren, so she's going to get the party started. You guys sharing the screens, Gabby?
I got it.
All right.
Well,
my technology challenged.
Yeah, no, you've got this, Gabby. I believe in you. So my name's Lauren. I work with the company that makes Dr. Foley's Icon IPL and her temperature radio frequency. So I have the fortune and opportunity to get to attend events with Dr. Foley and hear her speak. She is one of our key opinion leaders in the area, actually across the country, in the topics of dry eye and ocular surface disease. And so one of the devices that she speaks on is the Icon. And so I'm here just to join in on the party and have some fun with you guys. And we're going to talk about all the amazing things that IPL can do for you. Go to the next one. Thank you. So the first thing that we talk about with IPL, so IPL stands for intense pulsed light. And essentially what it does is it targets reds and browns in our skin. That's part of why we use it to treat ocular rosacea. That is redness that we see in our cheeks and around our eyes. Oftentimes it may start in other parts of our face and kind of migrate up and actually end up causing ocular surface disease, which results in us feeling like we have dry eyes. So with the IPL, we can go ahead, since it does target those reds and browns, and we can treat that ocular rosacea. But some of the other things we can treat with it that are a little bit more in the aesthetic realm or that skin revitalization realm are reds and browns, being sun damage, just if you have, like for me, I'm very pale, so you can see the redness in my skin very easily. I flush easily. And so I actually like getting IPL done because it helps just kind of keep my pigment looking smooth and like pale and not red, at least. So it's wonderful in that regard. And then the other thing that it does is it clears away sun damage. So if you go out in the sun, or as we age, start to notice we get some brown spots on our face and our hands, especially maybe our neck and our décolleté. So something like this is actually able to go in, and when it targets that pigment, it zaps it. And then what ends up happening is that pigment lifts up off your skin and it goes away forever. So sometimes we need a couple of treatments depending on where we're at with our skin and our quality, but it does a phenomenal job with it, and it's a very quick treatment. The other thing that we can do is we can treat unwanted facial veins. So whether that's, some of those little telangiectasias in our nose, some of those little tiny vessels we see in our chins, another common area that will have them. Those are both things that we can also treat with this. So it's one handpiece on a laser, but it does a lot of awesome stuff. Okay. Yep. So it is non-surgical. It does give you pretty quick results, and there really isn't a lot of downtime with it, which is wonderful considering what it can do for your skin. Oftentimes in aesthetics, what we find is the better the result something gives, the more downtime we have, which means maybe some things you can't even go in public for like a week or 3 weeks. Sometimes it's that you just have a couple of days where you're at home kind of with a, ball cap on, hoping no one sees you. With IPL, sometimes you can have a little bit of a visual, noticeable downtime, but oftentimes what we're looking to do is just put some sunscreen on and take care of our skin. I know Dr. Foley has her line of topicals in the office, and so she might prescribe or recommend something from that to help treat your skin post-treatment. But for the most part, we have a pretty quick turnaround, and then you get to see your results pretty soon after. It does kind of, I've had one IPL treatment done, and it's quick. It's really not painful. It feels more like if someone snapped a rubber band on your hand. And that's because we're actually pulsing that light and hitting that pigment as we treat, whether it be the vessel or like a brown or red spot on our skin. The light that's going into our body is what helps it. Well, one, the light is what gets rid of the pigment, but two, that energy going into our skin also stimulates the body's natural healing response. The body's response to heal, or what the response for healing is to create new collagen and elastin. So when we are literally in our like mid 20s, we stop making collagen at the same rates that we used to, as well as elastin. Elastin is what keeps our skin taut. Collagen is what keeps it plump. And so for me, I'm 28. My skin did not look like this a year ago. My forehead was loose and I had wrinkles in it. And, I just didn't have the same volume and thickness that I have. That all comes from collagen and elastin. And so when we're in our early 20s and we stop making that the same way we used to, it's then when you get to 40 and 50 and you're like, gravity just took a hold of my body and pulled it all the way down. What really happened was we just lost the building blocks of our skin. And so IPL, when you do get treated, even though we're looking to address those superficial pigments, will help with that collagen and elastin. And if you really want to drive it home, you go next door and you see Amy and you get a temperature treatment done, which will definitely build up that collagen and elastin. Yeah, so no downtime, you get excellent results. It is good for all of our skin types that are on the lighter side. Obviously, when we're targeting browns, if somebody has a lot of pigment in their skin, there might be a better alternative for them, or we might just have to kind of consult on that and make sure it's the appropriate treatment. But for the most part, this is something that everyone can benefit from. One of the most common places I see it are the back of the hands. If you're doing it for aesthetic purposes, because we're all driving in our cars, we've got our hands on our steering wheel and the sun's hitting it all the time. We don't even think about it. And so we can kind of treat anywhere where you might have that sun damage or those red spots that you're looking to get rid of. So before we jump into Skin Tell, Gabby has been doing the treatments. And so I was just wanting to hear from you, Gabby, on kind of what the experience is like. What are your patients saying during the treatments? What are the results they're getting? How quick is it? If you could give us some context.
Yeah, it's awesome because I would say 99% of people that come to see me, it is because of rosacea. So it's not often that I'm, exactly targeting the dark spots or anything like that. But I start to notice, because I like to harass people and ask them how their eyes are feeling every single treatment. So around treatment 3 or 4, we start getting that dry eye relief, which is amazing because, we still have basically a half of the series to go and we're already getting relief. We also notice that even though we are targeting those reds and seeing results there, they get to have that fun, experience of having that pigment start to come off and exfoliate. And it's just really interesting for people to be able to see that. And they always tell me, like, my friends are noticing a difference. And so it's really nice to hear all of that. for as far as IPL goes, especially like in school, we had a lot of different devices. Those ones are snappy. This one is by far a lot more comfortable. Most people were done within 30 minutes, so they tolerate it pretty well. Every once in a while, I have someone that wants to take some breaks, but I would say 9 out of 10 people are just fine getting it done.
Yeah, that's awesome. Yeah. And I love you saying that too, because I think one thing that is really fun in optometry, having lasers, right? Having these advanced technologies in your practice, right? Like Dr. Foley brought these in to treat ocular rosacea, to treat dry eye disease, to help with meibomian gland dysfunction, right? But you still get the aesthetic benefit regardless of whether that's what you're looking
our
for.
happy side effects.
Yeah, happy side effects. Absolutely. So I love that. Thank you, Gabby. So what we have on the screen here, this is called Skin Tell. And we kind of touched a little bit on it earlier, talking about people with a lot more pigment in their skin and making sure we have the right treatment settings for them. Skin Tell is a piece of proprietary technology that's only available with the Icon IPL that Dr. Foley has. And what it does is we take the top part of that has a little reader on it, and we put it on your skin in a couple different places where we're actually looking to find out how much melanin you have. It's going to read that amount of melanin in the area we're looking to treat, and then it's going to Bluetooth recommended settings to the device to guide Gabby. And not that she would always need it, but it's definitely helpful, especially for people that choose to avoid sun exposure. I actually know this one lady who I always thought, just assumed she was just Caucasian. I mean, she's almost translucent, but she has very dark hair and dark eyes. And when she and I were talking about her ethnicity, it came out that she's actually Mexican, and she can tan very, very easily and very well, but she does not go in the sun. And she wears, 60 SPF head to toe all the time. So looking at her, we might assume we would treat her like somebody that is my skin type, but that would not be the appropriate way to treat her because she has so much more melanin in her skin, even though we can't see it. So that's where Skin Tell is a really magical tool to help ensure that we're giving both effective but safe treatment parameters for every patient that walks in the door. So you're going to get the full benefit of the treatment, and you don't have to have any worry about whether or not it's going to cause any side effects. You are in safe hands, and this is going to help be a tool to get us there. So. Okay. Oh yeah, I always forget about this because it's been a while since I've had an IPL. I need another one. So there's this contact cooling that happens. So we kind of touched on how there's a little bit of a snappiness that happens. And effectively, it's just as the laser pulses, it's targeting and hitting that pigment, and you can just tell. It's not painful. But the other thing that the Icon does, which is the brand of IPL Dr. Foley has, is that it does contact cooling. So as it's treating, it's actually also cooling. So even if there is a little bit of warmth or a little bit of a snappiness, it's going to cool off immediately after that initial pulse. So yeah.
All right.
Makes it
So
amazing.
we have a video demonstration of what IPL kind of looks like from my perspective. And this is after your skin has been prepped and all the fun things. So we'll just let you see what I get to see pretty much every day, the fun lights and everything else.
So Flo, I'm going to measure how tan you are on your décolleté. So let's get some numbers. 1, 19, 20, 19. So we'll send this to the machine and we'll accept the 19. And that's fabulous. That's going to tell me what I can do. So I can actually treat you at 20 milliseconds and we'll go 28 joules per centimeter squared and maybe 1 or 2 passes. And that should get your low contrast lesions, because these dark spots, they bother you maybe when you wear some low cut clothing.
They do.
You sexy thing, you. Okay. Okay, so we're gonna just do a nice little treatment here. Eyewear on, and here we go. How am I doing?
Great.
You're doing great. And how's that feeling?
Wonderful.
Good. Not bad. Great.
I'm excited to see the results.
Yeah.
How long does it take before I actually see results?
It's a good question. So what you'll notice is the light brown spots will get darker brown. We won't be able to get all of them because you have that little bronzy tan. So what I'd suggest is you come in the fall after you've been out of the sun. I see you've been in the sun. I'm not going to yell at you because I like you. But you do know protecting the background skin is important for the treatment. So we can get the darker brown spots today, but the lighter brown spots we won't have as much luck with.
Will the brown spots just slough off?
Yeah, so they're going to get very dark brown. And you'll notice I'm doing a second pass in the other direction. We want to get 100% coverage of all of these brown spots. This is a comfortable treatment. It goes really fast. It's a great way to correct the brown and red discolorations on the skin, both on and off the face. That's what we love about the Icon treatments.
All right, beautiful. So yeah, I chose to show you guys a décolleté, so I didn't have you guys watching a 20-minute video of a full face treatment, but gives you kind of an idea of what
So Flo, I'm gonna
treatments look like for me, and you know what is happening while your eyes are covered.
Yeah, absolutely. No, I love that. Dr. Quibell is one of our other fabulous speakers. I know Dr. Foley's had the pleasure of working with her at some of our shows in the past, and she's obviously going, oh, Flo is her right-hand woman. And I love how she's like, oh, you sexy little thing, you know, they're just quite the pair. So I loved that video. Thank you for showing it.
That was great. That was
Yeah.
really great. I will say that one of the things that I thought was really cute about that was Flo was holding, they looked like something she was squeezing, like
little
one of those.
Shreks or something like.
Yeah, I thought that was hysterical. That was
Yeah.
great.
Well, and like even on that point, Dr. Foley, I think that, you know, at least from my experience as a patient, when I've had these treatments done, you know, you can't see what's happening, and we have to wear protective eyewear because we're firing these wavelengths of light that are not safe for your eyes. That's why Dr. Quibell put her eyewear on. That's why you'll see Gabby would put her eyewear on, but it's also why we have the patient wear eyewear. And I think that there can definitely be an anxiety when something's happening and you have no idea what it is. And so if you ever do need a squeezy ball or a hand to hold, just let the team know, because we totally get it. All of us have sat in the chair, and we want to make you as comfortable as possible. It's not going to be painful, but it can be a little bit like, what's going to happen next? And so there's definitely ways that we can kind of make you feel more comfortable if you do have those anxieties.
Oh yeah, my
Right.
poor clients, they only hear me talk and talk and talk them through it.
I love it. That's important. Talkesthesia. That's what we call that. Talkesthesia.
Well, and the weighted blanket kind of makes you feel a little more cozy, like someone's giving you a nice hug. And so I think I like that when I'm having treatments, because it just kind of makes me chill and relax. But I think we were thinking about giving people out some happy faces that you could squeeze.
And then we need to get a little mini Dr. Foley.
Or mini eyeballs. I like a mini
Yeah,
Dr. Foley.
Yeah, mini eyeball.
Yeah, there should definitely be, like, at least at minimum a bobblehead of Dr. Foley, because you're basically famous at this point, so you need one.
Oh God, that's pretty scary. That my husband would probably use that. That would be under stress relief. Oh dear.
Love
Oh
it.
dear. Okay. All right.
Dr. Foley, do you have anything else you want to chime in on regarding the treatment or what patients can expect?
Yeah. I think what's really wonderful about this is, since we're targeting those tiny little angry vessels around the eye area, we know how they cause so much inflammation in the ocular surface. This has just become kind of a revolutionary treatment. And literally we get, as Gabby was saying, people starting to get some almost immediate relief after they've had these treatments. It's very quick. And again, you can just put your makeup on right after. It's quite wonderful. The big issue is making sure you got that sunscreen. And boy, let me tell you, after years of being in Southern California, living with a pool, baby oil, Band-Aid Soleil, you know, for that Saint-Tropez tan, which was burn, baby, burn. I'm living, I was just thinking, Gabby, I need you to go after that left side of my face that had all that wonderful sunshine. So yes, I think it's fantastic. And we're seeing amazing results for our ocular surface patients.
Yeah, absolutely. It's funny you say, and everyone on the call, if you drive, it's going to be your left side of the face, because when you're in the car, in the windows, you're getting light from everywhere, right? So it's not just our hands. Also, oftentimes what we've noticed is that someone's left side of the face is going to be more sun damaged than the right side. So don't be concerned if that's you. It's just because you're in your car driving. And And yeah, I would say, Dr. Foley, like I agree with you, and you know, your patients are of course in the best hands they could be, obviously, with your knowledge, expertise, and experience with this device. You obviously have a highly trained staff, and so we're going to show you guys some pictures of what people look like before they have a treatment done with this and after. And these are standard. This is what we get consistently across the board, and it's beautiful because these results are pretty impressive. And regardless of whether you're doing it for aesthetic purpose or not, it's going to be life-changing when it helps cure that dry eye, and also gives you a little bit maybe of a confidence boost when you start clearing some of that pigment that maybe you've tried to cover up for a while. Oh yeah, décolleté. So sun damage, right? So we're looking at someone's chest here, and you can just see the total clearance of all those browns. Now this was 2 treatments. So oftentimes with any laser modality, whether it be the temperature radio frequency or the Icon IPL, we're going to need more than 1 treatment to achieve our optimal results. And it's just kind of, as Dr. Quibell was touching on, some of that more superficial or recent pigment's not going to be picked up as quickly by the IPL as that older actual age spot might. So definitely talk with Gabby, talk with your provider. They will give you a recommended treatment plan based on what you're trying to achieve, and just be prepared that it will likely be more than just 1 treatment. So that's a beautiful result though. Mm.
We have a question.
Oh yeah.
Yes, we do. So how do I send you a photo? She wants to know how to send you a photo.
I don't know how
Good
to
question. That would be a good question.
Oh, you have to go, you would have to hit the little note thingy, I think. Yep. So if you hit that little note next to the 2 box, I think if you pull a photo off your computer, you'll be able to send it that way.
Okay.
And then we also have, oh my God, whoever Terry is, you rock. Can't believe all the
She's
camera
amazing.
girls look so good.
Yes, she
She
does.
is amazing. Absolutely 100% amazing.
Terry, you can hang out with me any day of the week. But there is a question in here. Just last week, my dermatologist said that the only treatment available that will work for my acne cystic like rosacea pustules is IPL. And in combination with temperature MV treatments, IPL is the only treatment that has provided relief for dry eye vision, restoring vision and comfort. Thank you for sharing that.
Thank you, Terry.
Thank you.
Okay, so as far as the pigment recurring, so one thing that we say in I guess healthcare, right? We can correct the problem, but we can't prevent new ones from coming up. Just the same as we can help you catch up the time clock, and you know, get rid of age spots, but we can't make you not age anymore. And so what I would say to you is, to Dr. Foley's point, if you come in and you get one of these treatments done and you're clearing away sun damage or pigment, now pigment, things like rosacea and stuff can be caused by different environmental factors. So that's a piece of it. But as far as pigment brown spots go, if you are out in the sun and you are not wearing SPF regularly, which by the way, guys, I did not learn this until recently, you need to reapply sunscreen for it to be effective every 2 hours. So, and SPF in your makeup is not adequate. You genuinely need to be putting on a layer of SPF and then putting your makeup on over it to get that intentional sun protection. And another way that you can protect from UVA and UVB rays actually damaging and your cells and creating new melanocytes is by using medical grade skincare. Dr. Foley does have a line in office that I'm sure they'd be happy to tell you about. And there are going to be antioxidants and properties in that that are going to help protect you. So with that being said, it does get rid of it, and it will be permanent, but that's in the absence of environmental factors or external factors that will create new pigment in your skin.
Yeah, and I'd like to touch also on the sunscreen reapplying. We do have a powder sunscreen in office that is amazing for reapplication. So you put on your regular cream, SPF in the morning, and then throw the powder in your purse, and it makes your life so much easier, rather than every 2 hours getting a bunch of sunscreen wherever you are. So there's a whole bunch of options, so there's no excuses.
Yeah, I think everyone kind of thinks like, oh, SPF, I have to reapply it during the day. Like when you're at the beach and you're just like slapping on all this white stuff, you look crazy. It's very different when you're using medical grade and you know, professional cosmeceuticals. So it's a much more glamorous process.
Yes, it does. I had that Southern California, my beach guard, lifeguard at the time with the big strip of, the white zinc oxide on his nose. I'd be like, ooh. But yeah, I'm glad you said that, Gabby, because I've been putting that in my purse, and it's so nice because it kind of gets rid of the glisten from your makeup. And yeah, now that the masks are coming off, it's like, oh dear God, I have to wear makeup again.
Little touch up on the facial oils too. It's a win-win.
Yeah.
There's
And
another, there's
yeah,
another question.
what do we got? A friend told me yesterday that IPL will grow facial hair. Fact or myth? This has not been my experience.
If anything, it gets rid of it. It's not intended to do hair removal unless we're actually attempting to treat for hair removal. With the handpiece that we use for IPL, it does attack melanin in the skin, which melanin is in your hair as well. So, I mean, it might do a little bit of, if anything, getting rid of some hair, but it's not going to make it grow back quicker, and it's not going to make a whole bunch of a difference with hair removal. So
yeah,
probably not.
So myth. Yeah, we'll slap that one with myth.
Yeah.
That's a great question though. And I think it's an important point, right? Because we hear a lot of things, and that's why webinars like this are important, and tuning in and talking to people that know what's up and are constantly being educated and really engaged in what's the latest and greatest in both ocular, the optometry world, but also the aesthetics world, why it's really important to use those professionals to your advantage. So let's look at some more pictures.
All right. Well, we have one treatment here for some sun damage, some freckles, and this is after 4 months. So with her, she probably got that kind of crusting coffee ground appearance. That's really fun to see. But I think it's the one after this that is really cool. Yes, this one. So a lot of people with rosacea will get the little telangiectasias right through here and their cheeks. This is a more intense version of that, but it's really cool to just see that before and after. A lot of times when treating these, they will either get darker after the treatment and then lighten up, or sometimes you'll even see them collapse, which is just really cool to see that. I wish I can film it for you guys and so that you can watch it yourself, but it's part of the satisfying parts of my job. Okay, and I believe we have one more. Yes. Same kind of idea, a little bit more vascularity.
Yeah, nice. And that's just one treatment.
A lot of the vascularity is kind of as long as you get the right settings the first time, it's kind of a one and done, which is awesome. And it looks like on kind of the bottom left of that left photo, there's a little angioma there as well, or maybe a little tiny bit of vascularity that they also got taken care of. So that is awesome.
Yeah. And Stacy sent a question in. I might need you to clarify a piece of it, but I'll read it. Maybe it makes more sense to Gabby and Dr. Foley. Dr. Foley diagnosed me with dry eye disease. My eyes have been painfully dry and highly sensitive to dust and allergens every day for over 2 years. My question is, where do you do the treatment for the eyes?
So
I'll let Gabby go for it.
So when we actually treat for the eyes, we have two options. We have the eyes treatment or the full face. The eyes gets this entire area of the cheeks, as well as the nose and the forehead. So we're really just missing out on the chin and upper lip because both of those are just for aesthetic purposes. So basically treating a little bit lower down the cheek not only gets where most people have rosacea, which if you have rosacea on your cheeks, you most likely have that ocular rosacea. But we're also getting extra heat to those glands. So it's kind of a win-win if we treat a little bit lower so that we can get some extra wavelength, some extra heat to those glands and the ocular rosacea.
Yep. And, Gabby does a really good job of getting really close, and she's got this beautiful technique of pulling down. So you really get right up there without having any worry of having that visible light from the IPL coming in because you're protected. And it causes what's called confluence, this lovely physics term, which helps to irradiate up and then down. So you're going to get all those pink vessels that make the lids look pretty angry and unhappy. In some rare cases, we do have to put metal shields in the eye and treat over the lids, but that's incredibly rare, about 1% of the time.
Beautiful.
Yeah.
Yeah.
And this is a treatment that's done, in the office. There's no anesthesia or anything like that. I mean, you could literally come do this on your lunch break.
And I have people that come in on their lunch break.
There you go.
Okay. And then we have a whole bunch of frequently asked questions. So hopefully it'll answer some of your guys' questions. Okay. So like we said earlier, results that you can expect, we're going to decrease those brown spots as well as those vessels, and overall just get a more even skin tone. Results for dry eye, obviously we're taking care of that vascularity. So that's going to help with that irritation as well as heating up those glands. So overall, we're kind of getting the best of both worlds for everything. Again, most of the treatments that I do take about 30 minutes. Every once in a while, I'll get a 45-minute one, but most people are pretty quick and easy, and they're kind of just like, get it over with. Literally, I'll have people go right back to work after this treatment. You can expect a little bit of redness and kind of a sunburn sensation. So that's something to keep in mind. I wouldn't plan a hot date right after an IPL treatment, but some people, they are back to normal within 30 minutes. Some people, if they have a little bit more vascularity, they might expect more of that redness, that flushing, and maybe even a little bit of swelling inflammation, since it is the lymphatic system that cleanses out that redness once we treat it. So that is something to be expected, that if you do have a lot more rosacea, it can have a little bit more downtime. And then treatment amounts, it just depends on, we'll do a consult and kind of see where we're at, whether we're doing it for dry eye or if we are doing it for purely aesthetic purposes. I find for just general rosacea, if we're not looking at dry eye, it's about 6 to 8 treatments, depending on the severity. And for dark spots, it really, really depends on if you have a few, how dark they are, and just how much we have to really go deep into the skin. So it really just depends on what we are trying to treat. Again, you get that sunburn-like sensation. A lot of people, if they get that, they like to do a cool compress when they get home, and it feels really good. And again, 2 to 24 hours, more vascularity you have, more likely you're going to have a little bit more downtime.
And we just got another question in. So how long does the IPL help unblock the oil glands? Now, are we treating oil glands with IPL? I mean, that might be more of a temperature. What do you think, Dr. Foley?
So we kind of do a combination. If the patient has rosacea, then we're going to do a series of IPL treatments in combination with temperature. Temperature is kind of our foundational treatment when we're going to try to revitalize structure function of the upper and lower lids and to get good gland expression. So the nice thing about temperature is when you're doing the actual activity of the treatment that Amy's doing, they're massaging that periorbital area, heating it up to 40, 41 degrees centigrade, which is the magic number to get those glands expressing and bubbling and getting them less congested. When we do most, I would say probably 80% of our patients have a significant amount of rosacea as well as the gland blockage. So we do that combo of radiofrequency, a couple of radiofrequency treatments, a series of IPL treatments, and then we end with a series of radiofrequency treatments. And it's kind of like the master synergistic issue. IPL will heat the glands, but very quickly, and then they cool. So it's important, we're really going more for the vascular inflammatory component with IPL to treat the ocular surface. I hope I was saying things in a circle there. So there's no one size fits all for almost all of our patients. Are going to require a mix of things. And some of our patients, we can't do IPL because they have such dark skin types that we can't do an IPL treatment. We have to do temperature only.
Which thankfully people with darker skin tones that can't do IPL, normally don't have rosacea, so they're all set.
Exactly. Yes.
I have three
Fantastic.
questions. Three questions.
Sure.
Apparently I'm a question alert tonight. Okay. So the first question is, how long does the IPL help unblock the oil glands?
We just did that one.
Yeah,
I didn't hear you. I was too busy reading them all.
so I would say, it definitely depends on, no matter what, you need to have touch-up treatments when we're treating dry eyes. Some people get really good results from the series that we do, that they respond really quickly, where it's like, okay, just do a touch-up once a year. Some
Mhm.
people, their eyes were a little bit more stubborn, and so they're more closer to that 6 to 8 month touch-up area, where, it's just one touch-up per 6 to 8 months, which is a lot
Mhm.
easier than doing like, okay, let's wait for 3 years and then do 8 treatments again. So I would say every 6 months to a year, you should expect to have to just kind of touch up those glands, make sure we keep everything kind of cleared out.
And Gabby, with those treatment protocols that we're putting in place, we've talked a couple times about how most patients will need more than one treatment. So how far apart are you having your patients come in for their series of treatment? Are they coming in once a month, every 6 weeks? What are we looking at there?
Yeah, so for IPL, we try to hit that 4-week mark. Sometimes life happens and it ends up being that 4 to 6 weeks. But we normally shoot for the 4-week mark. Radio frequency about 2 to 3 weeks apart. So thankfully, we don't take too much of your guys' time. It's normally once a month for IPL.
Perfect.
If we were treating something purely aesthetic like acne, it might be a little bit closer together, just so that we can kind of get that P. acne bacteria taken care of. But for just rosacea, every 4 weeks.
Awesome. Thank you.
And I think the other thing too, there's another question about when you treat the eyes for severe dry eyes, do you or will you express the thick oil glands after an IPL treatment, or even after Tempsure? There was a thinking a while ago that it was beneficial to express right after IPL, but as we're realizing, there's more of a risk of bifurcating those fragile little thin oil glands if we do that, because with IPL you do a intense pulse heat, and then you're going along basically vaporizing those little nice nasty vessels. So right afterwards, after you're done with the treatment, you've cooled down quite a bit. So to go in there and squeeze is probably not a good idea. So we have halted doing that probably 3 years ago. So that's really not the thinking. And that's when I'm lecturing doctors now, trying to kind of get that across to them. Please don't express after. You can express after Tempsure because it's heating, nice and slow, and massage. But we have not seen huge benefits of doing it any longer. So we don't want to put people through that discomfort anymore, because their natural body is breaking things down naturally, as long as they keep doing their lid hygiene and their Be My Lady Steam Heat Mask.
So I just wanted to say, Terry just said Fully Vision Center pampers you. So treatment is more like a spa day. Gabby, you did the Glamour Girls proud tonight. Lauren, you too.
Well, thank you. I
You're
feel
so
like
sweet.
sometimes Amy gets all the pampering though, to be able to give the massages, and I'm just here zapping away at people.
Yeah, they tend to like my treatments a little more, Gabby,
A
sorry.
little more. I have the random person that prefers IPL, but yeah, most people are in love with Tempsure.
Both are
Which,
great.
just so everybody knows, we'll be doing the next event next month on, just so we shout it out, the 27th of April will be our Tempsure virtual event. So don't forget to come back and join us then.
Yeah, we'll be definitely talking a lot about Tempsure, and of course, all the wonderful things that Amy has learned from Gabby to make the process even more relaxing. And I always look forward to my full face. I'm sure. I love you too, Gabby. I love you too, because you're making me look glowy. In fact, I had 3 doctors this weekend at my and chatting in Miami when I was lecturing, came up to me and said, "You need to change your picture. You look way older." And I go, "That was before I was starting to do aesthetics."
You actually do look way younger now that I mean, yes, 100%. That's amazing.
I know. And, if anyone wants to guess my age, they can, because I just had a big milestone, which I'm too frightened to tell everybody what that is, but that's okay. So it does make a difference, it's amazing.
Dr. Foley, Stacy said, Dr. Foley mentioned a heat mask. Will you please explain this?
Sure. So our favorite warm compress, there used to be the Brooder mask, which was very clunky and big, and you'd have to heat up a microwave, and it wouldn't stay hot long enough. So we absolutely love these disposable steam heat eye masks. You can order them on Amazon. That's how we do. They're called Be My Lady. We kind of, call them BMLs, and they are fantastic. If you remember kind of those carbon activated warmers, if you like to ski, and our family does, you pop those puppies open and they get nice and toasty warm. The nice thing about these, you just slide them on your ears, and we heat up the patient before a temperature treatment. Sometimes that's something everybody absolutely loves the most. And so we put that on and get you to 40 degrees centigrade, and it'll last for 40 minutes, which is absolutely the bomb diggity. So it's wonderful to put on before you go to bed. I do when I'm in all these lectures and hotel rooms. It helps me sleep because I have a hard time sleeping without my hubby present. And it's just, I feel like a warm little hug, and I'm going to the spa. It's just absolutely amazing. It keeps my main glands up. It helps you along the way as you're going through your treatment. So we highly recommend the Be My Lady Steam Heat Eye Mask off of Amazon. So there you go.
Heather is making herself known. Hi, Heather.
Hi, Heather.
Hey, girl.
Great to have you here. I think we have a couple of doctors on here too that are actually listening in and taking some notes as well. So we invited them too. And so welcome, and thank you guys for staying with us.
I'm going to let us go full screen so that we can see your face.
Okay.
Okay, beautiful.
Okay. Are
right.
we ready for the giveaway time?
Ooh,
Is that what time it is?
I think
I
so.
think it's that time. Woo. All right, Miss Stevie. I think she's trying to get us some dancing
I
music here.
am. I'm trying. Here we go. Can you hear it? That's how it should come on before we give anything away from now on, right? Okay, here we go.
I feel like I
Okay,
have to
this
get
drum
the
roll,
disco
please.
ball.
Yes, and this is the lucky winner of a full face IPL. Let's see. Okay. I don't know. Okay. This always freaks me out. Terry.
My gosh.
She never would say anything. And now we're
We
on a
love
roll.
Terry.
I love it. The universe
Mhm.
was on your side with all that engagement, all the questions.
Right. Hello. So you know the
Yay.
routine. Give me a call, young lady.
Heather's a neat little idea. She's putting a little weight over the Be My Ladies to get even more pressure. Love that idea, Heather. I'm going to steal it from you. Thank you for that. Okay. Did you have some more to other cool little things? You got
Oh
that's
gosh,
right.
yes. I was
Just
reading
remind
all that.
everybody. Yeah.
The 20% off of any package. If you call, sorry, I'm an itchy fool. If you call me tomorrow, and on Friday before noon, you'll get 20% off of all IPL packages. Whoop. So there we go.
Awesome. Well, as always, you guys are wonderful. I so appreciate everybody here on our team. And Lauren, thank you so much. You always do such a lovely job. And what can I say? We're very blessed. We have a fantastic team here. We are so excited about all these wonderful things that we can offer our patients, and really seeing such amazing results with so many people that are suffering and suffering needlessly. And on top of it, we get these wonderful little side effects that I have to say, I was kind of like, judgy, aesthetic, judgy gal, because I'm thinking everyone's got the crazy eyeball and the crazy fish lips. No. I mean, we have so much fun, and I'm having the time of my life. It's really, I feel incredibly blessed, and to have the support of everybody here is just so wonderful. And they all love what they do. it's just such a yummy, wonderful environment. And I don't know, it's definitely, to me, the best way to go. So we appreciate everybody. We appreciate all of you that have tuned in tonight and have stayed awake for this whole thing. And just know we're here every month. We'll be doing a virtual event the last Wednesday of every month, and it's going to be a fun year. We're going to roll out 2022. We need that music, Stevie. We got to keep
Oh,
it going.
well, let me
All
start
right.
that up again. Here we go.
Remember, our team's been here since about 7
There we
earlier
go.
this morning. Yeah, so there we go. Okay, we're going to have fun, and we'll see you all next month. All right.
Bye, everybody. Have a wonderful night. Thank you for coming.